Let's take the fertility issue first. Why are people even afraid that it affects their fertility? Is it just a general fear of like, I don't want my fertility to be affected, so I don't want to bring any new thing into my body that I don't fully trust? Or is there specific evidence or anything that there is triggering that specific fear? Why fertility?
The anti-vaccine movement raises this concern with basically every vaccine. Actually, I think it's a little bit disingenuous to call it a concern. It's a lie. Basically, if you think about the optics of vaccine, right, you have a needle that is going into your body and feels apparently like a violation. And that resonates very strongly in a negative way for people who have high ideals of purity. And it's been found that the anti-vaccine movement does have such high ideals. So I think that's part of it. In this particular case, someone who is seemingly credible from a scientific perspective made the claim that there are shared sequences in the spike protein of SARS-CoV-2, the virus that causes COVID-19, and a protein that's found in the placenta called syncytin-1 or syncytin. It's called syncytin-1. And basically, prior studies have shown that an inappropriate immune response against this protein will prevent the ability to carry a pregnancy to term, will prevent the ability to potentially to get pregnant. So naturally, that was very concerning. When you actually went and looked at these two proteins and compared them, they have about 4 amino acids in common. The spike protein is 1,273 amino acids long. Syncytin-1 is about 500 amino acids. I don't quite remember the exact length. Like it's really not a reasonable risk by any stretch of the imagination. So, sometimes they make it a little bit easier for me because when they make concrete claims like a mechanism, I can go very easily and show this is not true. This doesn't hold water. This is where it's wrong. When they're vague about it, like it affects your fertility, I can't really do much more than say, well, there's no evidence to support that. And that's really not a satisfying answer for a lot of people.
Right.
I can understand why people, when it comes to fertility, there's not a lot of good information for parents, for example, who are struggling with fertility. They can try lots of different things, but often they don't know exactly why they're having an issue. And so in communities where people talk about problems with fertility, you often hear stories about, oh, this person just went over to here and changed their lifestyle. And all of a sudden, it was because they got away from the drinking water in their neighborhood, right? It's very easy to come up with explanations for why all of a sudden somebody had success, especially when there's this large group of people who are not having any success with any of the interventions that the medical community is able to offer. And then, so as a result, they see things like vaccines and they start hearing a story that, it could cause problems with fertility and they're just not going to risk it because it's almost like a superstition. It's like, why risk it if I don't have to? That's interesting. So what information do we have from a scientific perspective that this isn't something that people should worry about?
Well, for one thing, even though pregnancy was an exclusion criterion for these clinical trials, meaning that pregnant women weren't supposed to be included in them, some people always do get pregnant. And in this case, that happened. So it was about an even split in both the Pfizer and Moderna vaccine trials in terms of who got pregnant between the placebo and vaccine group. But it was about... I can't quite remember the exact numbers. I think in Pfizer's trial, there were about 12 pregnancies, and in Moderna's, there were about 24. And again, pretty even split among the placebo and vaccine groups. There were actually 2 cases of spontaneous abortions that happened. Both of them, however, were in the placebo group.
Interesting.
There are also several other lines of evidence that really make this unlikely. So for one thing, the spike protein is not just found in the vaccine. The spike protein is something that you are going to make an immune response against if you ever get infected with COVID-19. So by examining outcomes in pregnancy of people who are infected with SARS-CoV-2 who have COVID-19, you can show that it doesn't result in early pregnancy loss. And so far, that is what the literature supports. So even though pregnant women are, without question, very high risk for severe COVID-19 and should demand a very high level of attention and level of care, there doesn't appear to be any increased risk of early pregnancy loss, which is reassuring. In addition to that, you can actually physically look at the sequences of the spike protein and compare it against syncytin-1, and you will see that there's really nothing in common, very, very short stretches, but nothing close to what's needed for your immune system to make a mistake, really, and confuse the two things.
Interesting. That's so interesting. This does tend to highlight, I think, some of the fears that people have around the COVID vaccine specifically, and the studies that they've done on it, in that, when you're talking about these numbers, you're talking about 12 pregnancies and maybe a 6-6 split between the test group and the placebo group and the test group. It feels for some people that those are inadequate numbers. Like, how many people do we need to be testing to be able to say that that's actually a viable sample, and that it's not just such a small sample that you can't really derive anything from the information?
Well, I would agree that that's a small number, but you have to keep in mind that pregnant women are excluded from these trials because of bioethical reasons. There are a lot of consent issues when you do a clinical trial in pregnant women, because they're kind of making decision for quote unquote two people, depending on your specific views on personhood. And that's very complicated. And on top of that, because that choice affects a future potential life as well, you really want to demonstrate ahead of time that this product, this pharmaceutical, is at least safe in other groups. So that, I don't think is the very strong point of evidence. I think the strongest evidence comes from the fact that in COVID-19, where you are making a huge, massive immune response far greater than anything the vaccine could do, you aren't seeing these early pregnancy losses, which you would expect if this were true. And I think in addition, the actual bioinformatics part of it is probably also very strong evidence.
Interesting. So since we don't necessarily have like super strong studies, we haven't done, millions of people, tested them and then looked at the results, although we're starting, I guess we're going to start to see some data on that. Do you know? Are they tracking people when they're vaccinating now?
It's being tracked very extensively. So. Yes, absolutely. Yeah. So everyone who gets vaccinated, they can download an app on their phone called Be Safe, and they can report any symptoms that they're feeling, anything that ever goes wrong with them for monitoring purposes. In addition to that, there is the Vaccine Adverse Event Reporting System, or reporting service, VAERS, which they can file reports to. It's also a passive reporting system. There are also active reporting systems where basically someone is looking at anonymized medical data and comparing what happens in vaccinated people to background rates in the population. And there are a few health institutions that are affiliated with that program that's called the Vaccine Safety Data Link. There are a bunch of systems that the CDC set up to track this. Vaccine pharmacovigilance is extremely, extremely thorough. I think that it's probably more thorough than for any other type of pharmaceutical, just because it's a public health intervention. It's so trust-based.
Interesting. When it comes to fertility, though, do you know, are they recommending that pregnant women get vaccinated?
They can't make an official recommendation until a clinical trial is performed specifically in pregnant women to support that it's safe and effective. However, given the significant risks that COVID-19 poses for pregnant people, they have not barred them from receiving the vaccine. And the American College on Obstetrics and Gynecology has a document that you can use to facilitate a discussion of risks and benefits with patients. So, nice. I mean, if pregnant people want to wait, if they're not very high risk for COVID, that's probably reasonable for contracting, specifically, like if they don't work in a high risk setting.
Right.
If they feel, if they don't want to wait, I mean, it's very likely to be safe. There are, at this point, what are called developmental and reproductive toxicity studies, which are studies that we do in an animal model where we examine whether or not the vaccine has any effect on pregnancy or on the fetus or on the pup, I guess, since it's rats when they're born. And Moderna has already completed those and they showed no abnormalities. Pfizer has not publicly released those studies yet, but they verbally report no abnormalities as well. In general, I should say it is incredibly hard to use the immune system to tamper with a person's fertility. It's a very, very difficult thing to do, even if you're trying to do it deliberately. There are instances where people can't get pregnant because of immunologic factors, but in general, the reproductive organs are what's known as an immunoprivileged site. It's very hard for the immune system to even get there because from an evolutionary perspective, those are such important structures because you need to be able to pass on your progeny that you really work very, very hard to prevent any kind of issues there.
Wow. What about male fertility? I seem to remember hearing some stories about, we were finding that men who had COVID, they were finding evidence of it in their semen. Was it like months later? It was. Granted, this is for really having COVID, unusual. Not the vaccine.
Yes. So that's actually not that unusual. We didn't really start to pay attention to that kind of thing until Ebola, because we started to wonder about sexual transmission for Ebola, but it doesn't seem to be a very uncommon thing for a lot of viruses, but we just don't really have a lot of data at this point. I know of one small study that did show that having COVID-19 actually can adversely affect male fertility, but it was a very small study, so I'm not totally confident about like extrapolating those data to the general population. It could be an issue with that particular subset of individuals. But in general, it would be very, very hard and very, very weird for a vaccine to have any kind of effect on fertility.
Thanks for checking out this clip from our show.
To watch more clips or full episodes, click on our profile below.
If you want to stay up to date on all of our new episodes and videos, click subscribe.
And if you have any ideas for future guests or topics that you would like to see us cover on the show,
leave us a message in the comments or connect with us on any of our social media channels at Funtime Program
or on our website at funtimeprogram.com.
We'll see you in the next one.
Bye-bye.